Now, if you have established that your blood glucose is 3.9 or below, you treat it as the hypo. It is important that you are always ready to treat a hypo wherever you go. When treating a hypo, you need to follow these steps. Step 1. Take some fast-acting glucose such as Lucozade or glucose tablets. Don't have chocolate because it's high in fat and releases glucose too slowly. Your diabetes team will advise you how much to give. Step 2. After 10 to 15 minutes, recheck your glucose level. Ensure your hands are washed and dry because any trace of a glucose tablet might give you a false high reading. If it's still below 4, go back to step 1. Step 3. Your glucose level has come up and is now above 4. Have a small snack, or if it's a meal time, just give your insulin for your meal and eat. Some children can struggle to wait for 10 to 15 minutes to test their glucose level because they want to get on with whatever they are doing and they are really hungry. But it is important to wait those 15 minutes to test again and make sure that your glucose level has come up. Step 4. If for some reason the hypo hasn't been corrected and your blood glucose level has dropped really quickly, then you could end up feeling really drowsy or become unconscious, or could end up having a fit. This is fortunately very rare. The next bit of advice is for your mum or dad or anybody else who is around you whilst you're having a more severe hypo. If your child is unconscious or drowsy, never attempt to give food or drink. There is a risk that if you put food or drink in the mouth of an unconscious person, they might choke. Instead, you will now have to use a glucogen injection kit, also known as glucagon. If you cannot give the injection because it's all a bit too scary, ring 999 and ask for a paramedic. Try not to panic. You've got time to wait for the paramedics to get there. However, if you think it would be helpful to familiarise yourself with glucagon, you can watch a video about it and then you might find it less worrying when you've got to use it. This video can be found in the quick links section. Some children do have very good hypo-awareness after diagnosis, but others don't. Be aware that the number on the glucose meter doesn't always reflect the severity of the hypo. A child could be running around with a glucose level of 1.2, or they can be unconscious with a glucose level between 3 and 4. It is important to always check your blood glucose levels when you think you're having a hypo, so you can start to recognise your own signs and symptoms.